Coming up today, 12 kidneys, 24 surgeries spread across 8 states. Meet the one man who stepped up and started the life-saving kidney chain. Good morning, I'm Jessica Lovell and welcome to the Morning Medical Update. There are currently about 90,000 people in America waiting for a kidney transplant. The wait time relies on a lot of different factors, but finding a match gets much easier when people like James Cochran come forward to offer up their own organ, expecting nothing in return. Counselor James Cochran spends his days helping his clients find their purpose. But it was during his downtime one day when he found his.
My first awareness of it was through a podcast. It's called Stuff You Should Know. They had one on kidney donation and talked about what it entailed.
Little did James know that scrolling the internet for more information on organ donation would ultimately lead to him helping save the lives of 12 strangers.
I have the chance to make a choice that will make the world a better place, that costs me something that I am prepared to give and I have the privilege to give.
James started what's considered in the transplant world a kidney chain. It takes someone like James, a perfectly healthy person stepping forward out of nowhere, wanting to donate a kidney, setting in motion a chain of kidney transplants, in this case involving 24 people across 8 states. 2 of those transplants happened here at the University of Kansas Health System's Center for Transplantation. James's kidney was taken out here and sent out of state. He is considered the altruistic donor in the chain because it was his kind act that started it all.
It was an opportunity to really honor the value that every life matters, even if it's not a life that I'm aware of.
James doesn't think of himself as altruistic. He admits he got something out of it too.
I feel a measure of satisfaction. I feel a measure of pride. I can say that I have been able to do something that not everybody has the chance to do.
He says in researching the role of kidney donor, he found out it's just who he is.
We all are connected through this humanness that we possess. It always felt very aligned with the kind of person that I want to be and the way that I want to live in the world.
A world where we're linked together in some way, like the chain James helped create. And we're so glad to have James in studio with us today alongside Dr. Malika Gupta, a transplant nephrologist here at the University of Kansas Health System. We're also joined by Dr. Sean Coomer, transplant surgeon and the chief medical officer at the health system, the Kansas City division. Dr. Coomer, how are you?
Great, good morning.
Good morning, good to have you. Dr. Gupta, James, good to have you as well.
Good to be here.
So James, we're going to probably say thank you a whole bunch today, it's going to feel like. And I know that you did not do this for the recognition. You've said that many, many times, but walk us through the decision that you came to when you decided to give your kidney.
Yeah, well, I mean, I'm fine people saying thank you. It's a big deal. I think the journey for me started, I worked at a faith institution for a long time, had been a part of a faith institution for a long time, and left that under some really kind of frustrating and disappointing circumstances, and so was on a journey to kind of discover and identify what are my values, what does it look like to be an ethical person in the world. And as a part of that journey, sort of at the same time, listening to the Stuff You Should Know podcast, heard about the impact that a non-directed donor can have in donating a kidney. So I put it on my just sort of infinite to-do list of things that I want to get to someday. And I think it was the fall of 23, September, I think it was, I made a call to KU and just said, what would this look like? What sort of entailed? And so that started the long process of, intake interviews and taking my blood pressure at home for two times a day for a week, and a sort of a battery of tests over the next several months, culminating in having old Lefty taken out in June of last year, 9 months ago, almost exactly. So
I love that you said you don't mind
being told thank you, because you had said too, you go, it's kind of a cool thing that I did, and you don't mind saying that.
Yeah, I mean, as a joke, my day job, I'm a therapist, and so in the lead up to the surgery, I was taking about 5 weeks in total off, and in telling my clients, hey, I'm going to go do this thing, and they were like, wow, you're such an amazing person, and I would say, yeah, I really am an amazing person, and it gets a chuckle from folks, but the truth is, it is a good thing to be able to do. I think I've always tried to match that with the fact that I'm extraordinarily privileged. I have a job, I run my own private practice, so I have all the flexibility to take time away. My mom's a nurse practitioner, my mother-in-law is a nurse, my wife is a nurse. I've got all these people in my life that can sort of guide me through this journey in a way that allows me to feel comfortable and confident. And so it's, but at the end of the day, it is, the privilege is being able to act in alignment with my values, so.
Were there any doubts?
Not really from me. From my other people in my life, there were just lots of questions about, what happens if someone you love needs a kidney? And so then, talking about I think it was the Paired Kidney Alliance. There's a couple of different organizations really that try to do everything they can to remove every obstacle, including, the sort of family pledge of, should someone in my immediate circle need a kidney down the line, they will have more ready access to that resource. So again, the doubts that did occur to the people in my life sort of slowly started to disappear. Talking with folks like Dr. Coomer, my wife was with me the sort of day I met with 10 different doctors who sort of went through all that, and everybody at KU did a really good job of sort of putting us at ease, attending to the anxieties that felt most salient in that space.
And I understand, Dr. Gupta, most transplants don't involve an altruistic donor like James. So how special is it when someone like him comes forward expecting nothing in return?
It's very, very special. So thank you for doing that. That, as you know, it set in the chain of 12 people needing, so it affected the life of 12 people from one. This is just amazing. This has escalated so much. So it doesn't really happen when an altruistic person come forward. So we're really, it's a very special thing.
Can you sum up for someone who doesn't understand how a kidney chain works?
Yeah, sure. I will start with a pair of two because it's easier to understand, and then we can extrapolate it for multiple chains. So essentially, just imagine if someone has an iPhone and has a Samsung charger, and someone else has a Samsung phone and an iPhone charger. So essentially what we are trying to do is match up that the person who has an iPhone charger can get the iPhone charger from the other person. So that's how the kidney pairing works. So if someone is an incompatible donor-recipient pair and someone else, there is another pair which they are incompatible between themselves, but if we make a chain and they become compatible, that works out. So this is an example where we are talking about two couples, but if you just put in multiple more phone and phone chargers, then you can imagine how big the chain can get.
And in this case, it involved 24 people,
yes,
saving the lives of 12 people. And we're going to show you this map explaining how far this reached across 8 states, again, involving 24 people. 4 people were treated here at the University of Kansas Health System. It's just so amazing. What's the longest chain involving one of your patients? Is this it?
This is the longest chain. I think not just for Kansas City or KU. I think this is one of the longest chains around the country, I would imagine.
Dr. Coomer, I have to bring you in because you're always the first to tell everyone how amazing the donor is, and in this case, the donor is just saying, hey, I am amazing, and I already know that. So how great is that to hear?
Pretty fantastic. He's a hero, right? When we talk about donors, they are the heroes living amongst us every day. So it truly is a gift, and the complexity of this gift, creating a chain of 12 and then 24 people total, is just incredible. And I thank James for starting that, and the teams that do things in the background really did the hard work.
Right, and the fact that James had this actually on his to-do list, donating a kidney on his to-do list, that must delight you.
Yes, I had taking his kidney out on my to-do list.
Yes, you did. You sure did. And you did. You mentioned this behind-the-scenes work that goes on with you and your teams. And for someone who really doesn't understand how complicated this is, I know you guys make it look easy and we show this footage, but kind of explain what goes on when we're not just with, you know, one person donating a kidney to another, but now we're talking 24 people involved and we're going out of state, multiple states.
Yeah, just when you talk about just the complexities of the transportation and the OR schedules and all the support staff, including surgeons and anesthesiologists, it becomes really difficult to put together. I mean, but the part you also don't see is that all the people that came forward that were not donors and were screened, out of those 12 donors, they probably went through 50 people to try to make this, if not more, to try to make this happen. So, and then the logistics of travel and plane travel and making sure it's timely. You can't have kidneys out for too long. We want them to work on the other side. So it's just an incredible team that puts this together. I'm just one cog in this machine, but it's just an honor.
Yeah, no pressure at all, right?
Oh, I love it.
I know you do. I know you do. And you've said it. I mean, all donors are heroes. They're all special. What's it like getting to know, though, an altruistic donor? Because we don't always get to meet them. They don't always come forward. So to have one sitting with us today, what's that like, getting to know someone like James?
Yeah, I'm sorry I couldn't be there. I'm at our beautiful Southwest campus in Olathe, and I wish I could see him again, because I love seeing our donors after they're healed up and doing so well and telling a story like this. So it's just an honor to be part of the process and the team. I just couldn't be any more proud of James and his family, right? His support staff it's a big deal. Even though James was running full head into this, I know his loved ones were scared for him, and I understand that.
Well, be sure to ask your questions. You can use the chat on YouTube or Facebook. You can email the Medical News Network. That information is there on your screen. James, we often ask donors, if they want to meet their recipient. That's a pretty common question. And you mentioned when you and I first met that while you're open to the idea, it just really wasn't a priority. Just explain the story behind that, because you had really quite an interesting answer, I felt.
Yeah, well, I think for me, the values that made me want to do this in the first place was this, and actually I think it came up when people would ask, like, well, what if your daughter needs a kidney and you've donated yours? And again, that got addressed in a separate space, but for me it was, I want to live in a world and be a part of a world where when people need kidneys, they get kidneys. And it's not a question of, what kind of person are they? Are they a kind person? Are they an unkind person? Are they a Democrat? Are they a Republican? Are they, do they exist in some space where I would have some affinity to them? And instead just say, well, this is a human, and I believe that humans are sort of inherently worthy of love, belonging, dignity, all those things. And so I have a resource that I have, the ability to give. I think that one of the challenges that I think most of us encounter when it comes to trying to be an ethical person is, what does it look like to be good to the people in our orbit, and what does it look like to be good to all people? And it's really, if someone in my life needs a kidney, it's easy to think, okay, well, sure, I'll offer that resource. But thinking about, well, as you said, was it 90,000 people that are sort of awaiting kidney donation? Those people are no less deserving of kidneys just because they don't know me. And so certainly, like, I think what I've said to the transplant team is, I'm not opposed necessarily to making those connections, but I thought it was important to acknowledge that I want this choice to be a reflection of acting in alignment with my values, more than just, oh, well, here's a really wonderful person who's a really great mom or a really great caregiver, a really great friend, and don't they deserve a kidney? When in truth, I think every single person on that list deserves one. So it's really just about jumping in and saying that this is the way I want to live my life.
Yeah, like the humanity of it all. Thank you for sharing that part of the story. Share the part about your recovery. How long did it take for you to feel back to normal?
Yeah. I think if I'm honest, I'm probably not quite back to normal yet. I think the first the first like 4 to 6 weeks was just, wound care and, trapped gas in my, torso and all that kind of stuff. Really, I think most of the acute pain was gone after the first couple of weeks. I felt like I was walking around with my hand on my stomach because I felt like if I laughed too hard, like my guts were going to burst out of my scar. That was mostly psychological. Dr. Coomer did a really great job of sewing me up. I think beyond that, energy, I think, has been the thing that I've been trying to negotiate most, is trying to pay attention to the way that I nourish my body, the way that I rest my body. I was probably not doing a great job of that before my donation, and then I think the donation revealed how important it was to take those steps. So I thought of this year really as an effort to like bring my sort of battery health back up to like 100%. And I think it's pretty close to there. I'm able to, I work full time. I've got a 10-year-old and a 7-year-old, and I just the demands of like being a human being are just difficult. And so as I think that about 6 to 12 months is what I heard kind of at the outset of like it might take about that long before your energy levels return to normal. But really separate from that, I think it's increasingly becoming just like a thing that I did one time. It's not like my body doesn't feel every day like the body of somebody who donated a kidney.
You don't feel different,
right,
one kidney down?
Right. It's more just that I, whereas in the past it might take until like 8 or 9 o'clock to run out of gas. Now it's maybe closer to 5 or 6 o'clock. But that I see that improving kind of on a daily, weekly, monthly basis.
Dr. Gupta, long term, does living with one kidney create any medical concerns?
Not really. We select the donors to be the healthiest of populations, so their general life expectancy is so well that losing that part of the kidney function and the bodily function that kidney part contributes to is necessarily not affected. Previously, it was thought that donors can develop high blood pressure and stuff like that, but there are more recent studies that shows that there are actually no difference, and if you watch things, then your health remains the same.
Dr. Coomer, if someone signs up to be a deceased donor, how often do their organs actually end up going to save someone? What might prevent an organ from being able to be used as a donation?
Yeah, and deceased donation, it's a little trickier, but nonetheless, it depends on what area in the country. There are people that certain areas of the country donate more than others. There are also areas that have very aggressive organ procurement organizations. So, for instance, Midwest Transplant Network, which is our neighbor and does all of our work, they have a conversion rate, meaning once somebody is identified as a donor, a deceased donor, they have a conversion rate in the 75% range, sometimes as high as 82%. Whereas some areas of the country, it's sort of around 55%. We're working tirelessly across the country to improve that as much as possible. But things that can kind of keep people being donors, it could be that there's poor organ function in the potential donor that would not be a good fit for anyone. And then, of course, if someone has active cancer, that's a danger that could be brought on to the recipient. So we don't tend to take those organs, for instance.
Big picture, Dr. Coomer, what can we do to protect our kidneys? Hopefully stay off the transplant list.
Yeah, that might be better directed to Dr. Gupta, but nonetheless, it's really about staying hydrated and watching things that could hurt your kidney. People don't always think about this, but people have arthritis often take a lot of nonsteroidals, or even people that just get sore from working out take a lot of nonsteroidals like Advil or anything like that, or Aleve. You take a lot of those, this can be really damaging to the kidney and give you stomach ulcers and all sorts of things. So that's one thing, but there are certain things that we can't really control. Sometimes there are genetic diseases of the kidney, but diabetes and hypertension and obesity are very high risk factors for folks having renal disease.
Dr. Gupta?
Yeah, exactly. As Dr. Kumar said, diabetes is the most common cause of kidney disease in the U.S. So controlling your diabetes is very, very important. Controlling your blood pressure, because if two things combined is causing injury to the kidney, that injury accelerates. So people who have diabetes sometimes have hypertension together. So controlling those two things, just eating healthy, staying hydrated, avoiding some of these medications. These are called non-steroidal medications. So these are some of the things that a person can do, but as Dr. Kumar said, there are some diseases which are genetic or autoimmune, which the patient can really not do too much about. And, yeah.
I'd like to get to some questions from our viewers this morning. Dr. Kumar, Lynn has a question, and it is a topic that has come up before. Could we use kidneys of pigs to replace human kidneys at some point?
So as a matter of fact, that is going on in the United States. I think the first one of these transplants occurred in an investigational manner in New York. So these are genetically modified, so they do not create as much immunogenicity and rejection in the recipient. So it is ongoing currently.
Also, Stuart had a question, Dr. Kumar, if you can explain, because James had mentioned trapped gas after the surgery. What is that and what causes it?
So during the operation, we do in our institution, we do a hand-assisted laparoscopic procedure. So with laparoscopy, we need to have room in the abdomen to operate and see. So what you do in that situation is you insufflate the abdomen with carbon dioxide. It's important, it's carbon dioxide, so it's not, like oxygen would promote, any spark would cause a fire, but carbon dioxide doesn't. So we try to remove all that at the end of the operation, but some is in there, and that can sometimes cause referred pain in 15 to 20% of people, usually up to the left shoulder.
Dr. Gupta, yes. Jennifer has a question. What are the most common causes of kidney failure?
Diabetes is the most common. Hypertension can cause it. In our area, polycystic kidney disease is one of the other most common cause, and then there are some autoimmune diseases and things like that.
Dr. Kumar, a question from Amy, and especially since we were talking about this big kidney chain that was going throughout 8 states. How long can a kidney stay on ice?
So we try to implant these kidneys as quickly as possible, but and typically we'll want to do them in less than 12 hours. But some kidneys, like from deceased donors, will sometimes be 24 and 48 hours on ice. It decreases it's not directly on ice, it's been surrounded by ice. We don't want ice damaging the kidney. It's usually in a preservative solution that's very cold, surrounded by ice. And they can be 24 to 48 hours sometimes.
Dr. Kumar, we're gonna wrap up our program, and I just want to get your takeaway for those watching and listening. What do you want folks to take away today?
I want people to realize about donor awareness. I think it's, when James is there describing his experiences, one of the earliest things he said was, I put it on my list. And sometimes people do that, or they're thinking about it, and they just don't get to it. It only costs you a phone call to get a little bit more information. Call the transplant center, wherever you might be. Talk to the experts. Learn about this. There's no commitment beyond that phone call. But just get some education, because you might be the next hero that saves a life, or maybe 12 or 24, however long the next chain is.
Great message. Dr. Kumar, thank you so much. Dr. Gupta, before I get your takeaway, I want to sneak in a couple of questions real quick. Jean wants to know, is Tylenol better than Advil for the kidneys?
For the kidneys, yes. But Tylenol, if taken in high doses, can affect the liver. So there is always balance of how much medications you can take, but yes, better for the kidney.
Marcia wants to know, how rare or likely is it that a healthy person who donates one of the kidneys would ever need a kidney themselves later on? And have you encountered this?
Yes, we do encounter it. The percentage varies with population, but we do encounter it. I would say once every year we see a donor who, for a kidney transplant evaluation, so themselves needing a kidney. So once a year kind of here at KU.
Dr. Gupta, what's the big takeaway today?
I think I want to echo Dr. Kumar's point. It is very, as I said previously too, it's a very, very special gift for whoever will benefit from a kidney transplant. So donation is a very noble thing, and there are resources out there for people who are interested in doing that. And then the other thing I want to say is it's very important to manage your chronic conditions. So if you have diabetes, high blood pressure, it's important to keep that in control and go see a doctor.
James, thanks for being with us today, sharing your story. Thanks for sharing your gift. And I want to give you the final word. And what's the big takeaway from your personal story?
Just give yourself more credit, maybe. I think that it's so easy to be overwhelmed by the intensity of like what we imagine of taking an organ out of our body, but you are probably capable of more than you imagine.
Thanks again. Thanks to all of our guests for being with us. Thanks to our viewers. Have a great weekend. We'll see you back here on Monday. Coming up Monday on the Morning Medical Update. Cancers can be cured even after they spread. I'm Jessica Lovell on the next Morning Medical Update, the new approach that's offering hope in the later stages of disease. Monday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now, everywhere podcasts are available.